Well, welcome, listeners. My name is Enoch, and I've been doing a podcast called The Medical Inquiry. And we have gotten a privilege to be on YouTube today. Below you will find this once in a while. Yes, today I want to talk about something that is on every parent's talk, especially with this generation we are in. Everyone keeps asking, why is my child getting recurrent bacterial infections? I'm tired of doctors telling me bacterial infections. Uh, Others I hear bacteremia. What do they mean by bacteremia? These doctors are coining up words. They just want to get money out of us, and today I just want to address them. Why is your child getting recurrent bacterial infections, and what does this mean to you as a parent? Well, I would really want to begin by explaining to us what are bacterial infections and how do they differ from any other types of infections. Well, first, bacterial infections are basically, as you hear the word infections, anything we pick from from the environment that will make us sick is an infection, right? And then bacterial, it's basically these are small, tiny organisms that live around us. Even on my skin right now, I have bacteria. Even in my stomach inside, I have bacteria. This table has bacteria. If you really remember, we used to have there was some famous advert where they would get it would be a blue light, and then they show these kids babies like under the blue light, and they would see these small tiny germs, and they'll be like, oh, these are germs and all that. So but ideally those are bacteria. They are very tiny things, we don't see them. So someone would ask me, but doctor, you speak about bacterial infection, but last time I took my child and my child was told child has a viral infection. Yes, as I said, infection is anything we pick up from the environment that makes us sick. Now, virus is basically not caused by bacteria but caused by the viruses. For example, the one we know, HIV, can be a viral infection. Most of our kids or most of you adults, when you get flu, that's called a viral infection. So the most common types of bacterial infections that we have seen so much and you have experienced so much with your children are ear infections. Especially our toddlers, our young ones, they will mostly come and tell you, "Mommy or Daddy, I feel like my ear is paining, my ear is paining." Others, you find your children are having fluids coming out of the ears. So those are one of them. Things like cough. There are coughs that are really so bad, and even you find the child can't breathe at night, and most times, even at night, they're having sounds which we call wheezes. Like you feel a child is, it's like a whistle. So those are also one of the bacterial infections that our children can pick from the environment, and pneumonia is one of it. There's acute bronchitis. Those are coughs, and then we tend to also have skin infections, and this tends to happen in our children who are in 1 year and below. They tend to get skin rashes that are very funny, and you find the skin rashes have pus and they are disorganized in the child. They come with fevers. So those can also be one of the common infections we have. We have what we call a strep infection, a throat infection. Especially if most of us have been to hospital and doctors examine and they press around, they say open your mouth, then they start telling you that, hey, according to what I've found in your gut, there are swollen tonsils. So you may find we have those strep infections. It's a kind of bacteria that causes infections in the throat. So those are also very common, and our children tend to pick them, especially in school. You find what we call upper respiratory tract infections. Those are infections that will come basically. You may think they are viral. Child has flu. Either even you yourself you have flu, but then you find yourself there is cough, there is fevers, difficulties in breathing. So it goes beyond that, and those are sometimes our doctors call them upper respiratory tract infections. They just combine it all together. So those are most of the common infections that our children will mostly get. On my table, I have a client I was seeing, and ideally, she presented with symptoms that would really show that she was having a bacterial infection. And most times, when these symptoms come in, we think of malaria. So we went through and we did analysis, we did tests, and the child didn't have malaria. And so when you go to your doctor, there are various tests they will do, especially according to your signs and symptoms, that will really prove there is a bacterial infection. But for us as doctors, despite the signs and symptoms I'm going to share today, they may cut across many different diseases, okay? But the doctor, the reason why you go to your physician, it is to specify and to understand what are you suffering from. So me, a doctor, basically, when I do what we call a CBC, I'm actually having one right now. It's called a complete blood count. I think most of us, when we take our children to the hospital, it's one of the biggest tests that are done. You get to find what you get to look and analyze your entire white blood cell, especially the white blood cell counts of the child. And we mostly focus on the white blood cells. Now, you know, white blood cells are cells that helps us to fight infections. They are like the army, they're like soldiers, they're like the police we have in Uganda. So when you have an invader, a bacteria getting into your body, so your body will respond by releasing these white blood cells to come and counteract, fight this enemy that is trying to invade the territories. So when it sets in, when we do a CBC, a complete blood count, we get to see these patterns, the rise and the falls, and we can identify and we say that, you know what, your child has a bacterial infection. But most times when you come to the hospital, the reason why you mostly get diagnoses of bacterial infections or bacteremia, it's basically sometimes when we doctors we are trained, when your child comes to us, and we do the tests, and we find maybe that you spoke with the doctor, he did the investigations, he did all that he's supposed to do, and he did not identify the cause, but the child is having the fevers, is having the vomiting, is typically weak, all of that. The doctor, when he does a CBC and he sees the patterns of the white blood cells going high, he will tell you the child has a bacterial infection. But we cannot specify where the problem is coming from, because in the physical examination and the talk that you had with the doctor, they were not able to understand, or they're not able to pinpoint where it comes in. But because of what I've done in the CBC, it is a bacterial infection. So I will automatically tell you that, well, you have a bacterial infection. So before I go to what the doctor does and all that, the typical signs and symptoms, what you should look out for your child when they have a bacterial infection, definitely there will be a fever. Every child, most of the bacterial infections we get, children will present with fevers. They are burning up. The temperatures are high. They're around 38.9 or 40, and sometimes they're convulsing. They are shaking. You get a child is shivering. So fevers are one of them. Okay, they can be really fatigued and tired. You find the child is always sleepy. The child who was playing lively, the appetite is down, they don't want to play, they are always sicky, they want to sleep. So those are some of the things you should look out when children have infections. And other things you can see, you can vividly see the cause of the bacterial infection. Sometimes when our children have wounds, you find a child has a wound that is really having pus on the leg, or the ear is oozing pus, automatically those are signs of bacterial infection. So I will not generalize that this and this, but those are some of the things you should look out. Fevers are number one. Headaches, two. You will find the child is overcrying, or the child is irritated, child doesn't want to eat. So when we do get those things, you better be prepared to know that your child is not feeling well and we need to go see a doctor. So yes, doctor, you have shared all this, you have told us all these things. Now, why is it that my child is currently getting bacterial infection? I treated this month. Within 2 weeks, I'm back in the hospital. The next month, I'm back in the hospital. Why am I having to spend much money in hospitals because of a bacterial infection? I don't they have treat it once and it goes for all? Well, you should understand, children below 5 years are developing. They are getting to understand the world we are living in. They are growing. So even their immunity, their ability to fight bacterial infections, viral infection is also developing. So you find they are easily able to capture things in the environment, and they're easily going to get sick. And basically, at that age, they are very discovering. If you can concur with me, your child will touch every place in the house. Whatever they pick, they just want to take to the mouth. So they can easily pick whatever is in the environment, and they can easily get sick. So that's why you can treat it now, and then the child is better for 2 or 3 weeks, and then the child can pick it again. So their immunity system is developing, and we give it time to develop. In most cases, when children start clocking 8, 9, 10, the rate at which they are hospitalized has to go down, because the body now has learned how to deal with the different germs or bacteria that come in the body without even having to go and see the doctor or to go for the rigorous tests. Well, yes, underlying health conditions. Some of our children have things they are battling with. For example, God forbid, the child has asthma. Automatically, all the child has hypersensitivity. They are very easy. They are very picky on the things they eat. Whatever they touch, they are too allergic, I would say. So you find their system can easily is compromised and they can easily pick up whatever is in the environment. For example, a child who has asthma, if a child who has asthma gets to be in a place that is crowded and with kids who have coughs, maybe a bacterial cough, they can easily pick it up because their system is fighting a chronic illness, and then their system is a bit weak, so they can easily pick all that from the environment. Even the environment in which our children live in, our schools, the kindergartens we take our children, the daycare homes we take, even our own homes. And sometimes our own homes are crowded. You find like 10 people sleeping in one room. So the air circulation, whatever we breathe, whatever we take in, how we associate with people around us, we can easily pick these things, and our children can easily pick all these, and they can easily get these infections over and over again. Now, the last point I want to emphasize it so much because it's causing a big problem to the generations that are coming. It's called the antibiotic use. Ideally, you can easily go to a pharmacy and you say, Doctor, I want amoxil. I believe all of you parents can concur with me because at one point you did it. So nowadays, antibiotics are so easy and in reach for us to get. You can just get them as they're getting paracetamol, as they're getting any medication for headache. You can easily get these antibiotics, and people are using them without the prescriptions, without the doctor's knowledge. So you find these organisms are being fed on medicine that they do not need, or they are being destroyed. Okay, and they start to find ways of learning how to defend themselves. Now, when you bring your child in the hospital really sick, the doctor would really use the same medication which you bought, which will not really work. That's why sometimes you find you go to the hospital, the child is having a bacterial infection, the doctor used a medication, and you come back, doctor, the medicine is not working. Why is the medicine not working? You guys are taking my money. It's because of how we are misusing antibiotics. And the other school of thought is this: when you use antibiotics unnecessarily, you see, not all bacteria are bad, okay? Not all bacteria are bad. When we start going into our stomachs, into our gut, we have bacteria which we call normal flora. Those bacteria are supposed to be there. Ideally, we are in a mutual understanding with them. I feed you, you protect me. That's how they are. So when you're taking antibiotics unprescribed, misusing them anyhow, you kill those bacteria. Now, when you kill them, you expose the body to get more embedded with these bacteria, and they come and they can easily make you sick. So, patients, so parents, be very keen on how you use medicine that is not prescribed, okay? And use antibiotics with caution. Ideally, all is said and done. Me, I don't want to come to the hospital. Doctor, I'm tired. I've spent a lot of money. I always believe in prevention. And as it said, prevention is better than cure. Okay. And the World Health Organization is now big on prevention. So, how we can prevent this from not happening to our children is hygiene practices. It's very good for us to have that culture of good hygiene practices, because with good hygiene practices, our children will not be able to pick up all these infections from us. If you have a child who is sick with a bacterial infection, when you do go home, be very careful with the utensils you use on that child with the other children in the house. They can easily share whatever they do have. Okay, vaccinations. We have vaccinations. That's why our children are vaccinated when they are young, so that their immunity that is developing can be strengthened. That in case when they come in this community and pick on these bacterial infections, they are not going to get the worst of it. Okay, but they will be able to fight, and they will be able to really thrive as children. That's why we thank for the vaccines that we have been getting so far the time. That's why in most cases you'll never find us having some of those coughs that used to be back in the days. BCG came in, okay? You rarely see things of diphtheria happening in our communities because of vaccination. So vaccinations are very crucial, and following them according to the calendar for your children is very important. Healthy lifestyles. Okay, I always tell people the best medicine you'll ever get in this world is your food. Okay, if you do it right, eat it right, you will overcome many of the challenges that mostly come along because of sicknesses. Okay, so because we need to empower our immunities and our children are growing, having a diverse of a balanced diet for them is very powerful. And don't forget, fruits are always beneficial for the children. So back to my case, my patient here. So his major complaint was the mom came in and said, by the way, he's 3 years old. The mom came and said, "Hey doctor, my child here has a fever, has been having fever, and the child keeps on complaining. He's not eating, he's always sleeping, and it's been 2 days so far." And the mom is worried. So the mom came in just as a routine check for malaria. But we encouraged them. We said, "Yes, mommy, we are going to do a malaria test, but we also want to do a CBC to really check and see if there are any possibilities of a bacterial infection." And when the results came out, he did not have malaria. Okay, he had the bacterial infection, and his white blood cell count is really short. Okay, his granulocytosis, to those medics who really understand, is really high. So he qualifies for bacterial infection. And with our child here, we really couldn't identify what was the exact point of the exact point where the infection would come in, because it doesn't have a cough, it doesn't have flu. It's just a fever and basically not eating well, no diarrheas, no pain when they are urinating. So we decided to begin this child on antibiotics, and that is because of a prescription of the doctor. Okay, so when you go to the hospital, the doctor will speak to you the same way I've spoken with you. They will do those tests, they will interpret them, and then they would better help your child so that the child can be able to fight infections. So most cases, just as I conclude, mothers would ask me, "Doctor, so why are you giving my child this medicine? Why are you giving my child an antibiotic for a bacterial infection?" Then I will say, let's put it in this way. I told you first we began white blood cells soldiers, right? They are like the army, the police, okay? They fight infections. So when I give antibiotics, I am just giving guns to them, okay? We are saying we have an invader, we know you are able to fight. Now let's give you guns and you complete the mission. So antibiotics in this case, they work like guns for them, and they help to eradicate and kill all those infections that would cause the child to become sick. Well, when your child is sick, do not keep your child at home and manage them alone. Always seek medical advice, okay? For children, it's very good to see a pediatrician, okay? And even in some cases when things have failed, specialist referrals are very important. When you see a doctor and a doctor tells you, your child has maybe meningitis, God forbid, and we have given this medication but don't seeing a response, I think there's this doctor who's good in pediatrics, okay? Let's refer you to that place. The doctor is not per se, the doctor hasn't failed in management of your child, but we believe in working, and we believe there's someone with more knowledge above everyone, isn't it? So when they refer you, it is a way of treatment, it is a way of finding a solution for our children to better get better without just losing them with trials and errors. So when your doctor refers your child, it's for their best interest. Yes, thank you very much for listening. I hope you have been blessed with this, and we can understand why do our children get recurrent infections and why is it a constant occurrence. Okay, when you get a bacterial infection, most times you can ask your doctor, "Hey doctor, I hear it's a bacterial infection, but where could it come from?" Your doctor will better explain. If there's no cause, he will explain to you according to the results, so that our children can grow healthy and thrive and become the next generation of leaders. Please subscribe and feel free to comment, ask any questions about bacterial infections, and what do you feel I missed out and what should have been shared. Thank you very much, and catch up. Bye.